Oh, that shot down.
Yep.
Man.
I want to go all the way down sometimes. Okay.
Yeah, that
So I was looking at your chart, and I saw we got some jaw stuff, neck, hips, low back. So
Yeah.
talk to me a little bit about what's going on.
Man, I just played hockey for 25 years and injuries, and as I'm getting older, I'm realizing that I've taken care of my body. I still lift a lot. I've done a lot of mobility and functional workouts, but the main thing is my jaw. I've never had a fix for my jaw.
Okay.
Just wear and tear on the body. Shoulders, hips, back, kind of normal stuff.
Okay. With the jaw, is the pain that you have, is it more achy? Is it more sharp? How would you describe it?
So it only gets achy if I'm having to really extend it and use it for long periods of time. Like if I've gone snorkeling, it'll lock up on me. Every day though, it's not really that bad. It pops.
Okay. Yeah.
You'll see that.
Clicking and popping when you're opening it.
Exactly.
Okay. And then your neck and your upper back, is that a dull achy pain? Is that sharp or burning?
So the neck part, I think it's gotten a little bit better, but I can go about right here versus I can kind of touch my ear to my shoulder over here.
Yeah.
I got a concussion playing hockey, just men's league about a little over a year ago.
Mm-hmm. Are you having any numbness or tingling in your arms?
No.
Okay.
Man, I have no pain. It's just when if I'm going to do chest, I got to make sure I really warm up my shoulders. Otherwise, I'm going to have shooting pain in my shoulder.
So more so stiffness, tightness.
Yeah.
Okay.
Yeah. The only thing that's hurting is my right hip. And I think it's just I don't know if it's a labrum or it's deep in there. That's the only, but it's fine,
How does that feel? Is that the same, or is that more sharp or?
This one is more sharp.
Okay.
Yeah. If I squat, or gosh, if I'm running for long periods of time, it'll just it's just a deep, almost like a joint pain.
Yeah. Okay. So it kind of alternates between a deep ache versus a sharp stabbing.
Probably more of a deep ache is what I would say.
Okay.
Yeah.
Gotcha.
Yeah.
Okay. Let's have you come on over here. You'll just have a seat, and we'll take a look at your neck to begin with, and then we'll kind of work our way around.
All right.
All right. So let's just start by seeing that range. So bring your chin down to your chest. Okay. And then look up towards the ceiling back as far as you can. Okay. Look over this right shoulder as far as you can. And then your left. Yeah, we're definitely turning better to the left. And then tilt to the right. And tilt to the left. Yeah. Okay. So we definitely got something going on over here. Let's see what that is.
Yeah, I think it's a new normal. It doesn't hurt, but I know it's not fully mobile.
Right. Not quite what it should be. Okay. So we do have a little bit going on here at the occiput, which is basically where the skull connects to the first bone in your neck. Mm-hmm. And we also have some going on a little bit lower down.
Yep.
So I'm going to hop up here.
Cool.
Let's have you lean back on my leg. Good. We're going to tilt you to the side. Okay. Kind of a quick movement here. Good. Doing okay?
Oh, yeah.
So that one's kind of a more deep kind of adjustment with that skull. We're going to do a little lower one over here.
Holy crap.
What do you think about that one?
Yeah, that was deep, man.
A little wild, huh?
Holy. Wow. That's a ringer.
Yeah. So we're going to hit this lower right side now.
Cool.
So one more time, we're going to go here. Good. Good. Definitely a little bit more muted on that side.
Yeah.
So what we may need to do is just decompress you.
Cool.
We'll kind of see how that feels as we get towards the end here.
Yeah.
Let me have you just turn to the right again. Better.
Oh, yeah.
To the left. Okay, and then tilt right. Better. Okay, so we're already making some progress. We probably need to decompress this to get the rest of that. Mm-hmm. Let's have you lay on your back for me. Your head will be up here by the paper.
God, that was deep, man. Holy. That was loud, huh?
A little bit of a crazy one. Scoot down a little bit.
Yep.
Right there. Okay, I'm going to cross these arms. Big breath in and blow it all the way out. Good, loose shoulders. A little bit. Again. Good. One more. Good. Okay. Most of that released pretty well for us.
Yeah.
Let's scoot you up now a little.
Cool.
And I'll give you this pillow. Okay, so we're going to take a look at the hips and just kind of see what's going on there.
Cool.
If I lift this hip, any pain just in this position? If I start to rotate you?
No, I can feel it, but no.
A little bit of tension?
Yeah.
What about if we rotate this way?
No.
Nothing really. Okay. And if I go here?
Nope.
Okay. So it feels a little tight.
Yeah, I can tell you it's like right here.
Mm-hmm. Any pain right here? What about
Nope.
here?
Nope.
Okay. This hip definitely feels like it's looser.
Yeah.
Moving better. Let's have you go face down real quick. Any pain here?
I can feel it on this side.
Some tension.
Yeah.
What about
tension.
here?
Nope.
Here?
Nope.
Okay. Here? Okay. So we definitely want to hit this SI joint as well as that hip. So let's have you lay on your side. You're going to face me over here. Good. And this arm will go up. Perfect. Okay. So this is going to be for this joint right back here on this hip.
Okay.
And just be loose as you can for me. Good.
Good.
That's okay?
Yeah.
Let's go to the other side. Okay. Let's put that arm up. Yeah. Good. Okay. Flat on your back. So we're going to pull on this hip here and try and decompress it.
Right.
Good.
Yeah.
And we'll go here. Arm more loose as you can. Good.
Felt that one.
Yeah, scoot up a little bit. So let's try this one more time.
Okay.
Feeling okay here?
Good.
Feels like you got a little bit less tension on this side now.
Yeah, I feel better.
Okay. Now let's take a look at your jaw, kind of see what's going on there. So,
All right.
scoot up just a little bit. Okay. Open, close, open, close. Yeah, we got clicking, popping there. Now just let it hang slack, just as loose as you can. Yeah, pretty tight. So we're going to adjust this. So what we're going to do is we're going to turn your head to the side.
Okay.
Good. You want your jaw just to hang slack, as loose as you can. This one's just kind of a quick one.
Was that my jaw?
Yeah.
Oh my god.
So now we're going to do the other side.
Dude.
Good. Okay. Loose. Good. Let's try one more on that left side. Okay. Okay, slack. There it is. Okay. How are we feeling?
Good.
So the clicking and popping has to do with that little disc that's in there.
Yeah.
It's kind of popping out of where it should be and then snapping back in.
Yep.
So you feel that popping as you open and then another popping as you close. That's that disc kind of snapping out of position and then snapping back.
Yep.
That sometimes reduces with repeated jaw treatments.
Okay.
I'm also going to show you an exercise here at the end that
Cool.
you can do to try and help reduce some of that. But what you should feel is some more looseness in the jaw.
Yeah, I mean, I can already tell it feels looser.
Yeah.
Yeah, cool.
And then let's decompress you and see if we can get the rest of that neck.
Okay.
So let's have you lift that head up for me and then set it down. Good. Okay. So you're going to feel a gradual pull and then a little quicker one.
Oh, that shot down.
Yep.
Man.
I want to go all the way down sometimes.
Yeah, that did. I felt that in my tailbone.
Yeah. You definitely needed a decompression.
Holy smokes. Man.
Okay.
Awesome.
So let's take a look and see how we're looking now. So I'll have you sit up again. We'll look at a couple of those motions one more time here. So let's have you look over your right shoulder. Good. Look over the left. Okay. And then let's have you tilt right. Way better. And then tilt left. Okay, one more time to the right. How's that feel?
It's good. I can still feel a little bit back here.
A little something.
But yeah, just a little something.
Yeah, so typically we got to come in here and clean this up a couple of times to get that
makes
to
sense.
fully release.
Yeah.
But that should help significantly. Okay, let's have you just come back, have a seat over here.
Yeah.
So the last thing that we're going to do is just kind of teach you this little exercise. It's pretty simple. Basically, as your jaw is opening, the first part of that movement should be a rotation. So it should just rotate.
Yeah.
The second part of that movement, the jaw begins to slide forward.
Okay.
What happens sometimes is we start that sliding movement before we should, and we get disc issues where that disc starts popping around and going all kinds of crazy. So what we can do is you're going to hold your tongue to the roof of your mouth. You're going to press it to the roof of your mouth. Then you're going to open your jaw slowly as wide as you can, keeping your tongue on the roof of your mouth. It can be pretty difficult to do.
Yeah. Okay.
You want to get as firm a contact with the tongue as you can on the roof of the mouth.
Yeah, I can't open fully. Is that normal?
Yeah.
Okay.
So what you'll notice is as you start doing that, you're going to do that for like 20 or 30 repetitions. You can do it multiple times a day. You can do it every day.
Cool.
But what it's going to start trying to do is retrain your brain to rotate first and then slide.
Got it.
And a lot of patients notice a reduction in the clicking and popping with a little bit of repetition on this this exercise.
Cool.
And so that's kind of retraining that opening mechanic to get you into a more functional opening. And hopefully we'll get a little bit less of that disc type issue going on.
Awesome.
Well, cool. How do we feel about our visit?
Man, that was great. Dude, I feel way looser, a lot better. That was super helpful, all those exercises. That was some loud pops.
Good.
Yeah.
Good. Yeah.
Cool.
Well, happy to help, and let me know if you're looking for somebody in London, because I've taught some seminars out there.
Really?
And so we might be able to link you up. Now, depending where you are. London's a big city.
Yeah, I mean, I'll be just south, but I'll come back every probably 4 to 6 weeks. So I'll plan on just coming back whenever I'm in town.
Yeah.